Are you in need of immediate access to healthcare?
Do you require medical counseling by a trusted healthcare provider?
Would you like to know more about immunizations available to you?
If you answered yes to any of these questions, then stay tuned for this episode of
MedTalk. Welcome back to MedTalk.
Today's topic is
Pharmacist Services.
I'm Dr. Joseph Rosales.
And I'm Dr. Mikaye.
Now before we get started, let's check in on our live Twitter feed to see if our audience has any questions.
At Confused Patient 1883 says, are you the people who work at Walgreens and give me my drugs? #confused. Well, you got it, but do you know that besides providing you with medications, a pharmacist can work in inpatient clinics, outpatient or ambulatory settings, long-term care facilities, physicians' offices, and within a variety of other health systems.
Interesting note. Now let's look at our second post. At Puzzled Patient. I thought pharmacists just fill prescriptions? Well, we do, but pharmacists are increasing their roles as members of the healthcare team. One of the important services that I can provide as a pharmacist include providing immunizations.
That's right. All 50 states allow pharmacists to administer vaccines with varying limits, so you can visit a pharmacist at your local clinic or hospital if you want to get vaccinated, or just discuss the vaccination options that are available to you.
For this part of MedTalk, we'll open up the floor to the audience for questions.
Oh my gosh, me.
You and that fine drugs and wine sweater and friend, come up to the stage!
Okay, my question is, can we really trust vaccines?
Good question. Now, whether or not an individual receives a vaccine is ultimately up to them, but it is also good to keep in mind that more than 50,000 adults and 300 children die from vaccine-preventable diseases or from their complications within the U.S. each year.
On top of that, immunizations assist in preventing an estimated 14 million cases of vaccine-preventable diseases and 33,000 cases of death.
Yep. And even if we don't administer the vaccine, there are plenty of things concerning immunizations that we can help with in general. Now, for example, we can screen patients,
Give them counseling,
work with documentation,
manage formularies.
and even educate the public on all the latest medication measures.
Wow, you guys help patients in a lot of ways. You almost seem like doctors.
Not quite doctors, but I would definitely consider ourselves healthcare providers.
Provider Status 2017.
Speaking of doctors, during my last doctor's visit, they ran some tests and told me I was pre-diabetic. What's up with that?
Well, if you want to avoid getting type 2 diabetes, you should be sure to exercise regularly and maintain a healthy diet.
Diet? Well, that's perfect. I just started my diet yesterday.
Anyway, you're going to want to avoid that as well.
Yeah, and you're going to want to give me that and listen to their advice because they just want the best for your health.
I guess that makes sense. My diet really hasn't been working anyways. Man, pharmacists sure know a lot of things.
Yeah, we can provide counseling education in a variety of areas, including but not limited to diet counseling and diabetes self-care skills.
Exactly. We're always here to help, so the next time you see your local pharmacist, feel free to ask them if you have any questions about the health services that they can provide for you.
That's awesome. Now I know so many more people to go to for questions about my health.
As a pharmacist, patient health and well-being is the #1 priority.
Exactly.
Well, that's all the time we have for today, so thank you all for coming out to
MedTalk!